Okay. Good evening. We are live. We are broadcasting on YouTube. For those persons that join us online, thank you so much for joining us tonight. If you have a question or comment that you would like to ask our presenters, we please ask that you would type it in the chat section and it will be repeated later on during the session. Tonight, our session for Family Night is about Medicare, something that we all hope to get if we haven't gotten there already. And so tonight, we're blessed to have Dr. Robert L. Stokes and his wife, Mrs. Susan Stokes, who will be here talking with us about many of the changes and questions that we have about that wonderful benefit called Medicare. Yeah. Dr. Stokes, who is a member of Mount Zion, has been practicing medicine for almost 40 years. We know him in this community as a basketball player and many other things, as a trustee. And we're just blessed today to have he and Mrs. Stokes come ask a couple things as they present tonight. If you have questions, I would suggest you write them down so you don't forget them. If you need paper, we have some blank paper we can pass around as well. Additionally, on each of the sets of tables, you will find a microphone. I know that you think you speak loud and you use your teacher voice. However, the person who is online cannot hear you from Louisa. Therefore, please pick up a microphone, push the button all the way to the top, and talk into my. It is important that people online cannot hear us otherwise. And then I start getting phone calls and text messages I can't hear. So to help me out, please do that. Tonight, please help me welcome Dr. Robert and Mrs. Stokes.
Yeah, we got to stand up. Thank you, Jonathan, and it's a joy to be here to try to help you with Medicare if you've already had it, and if you haven't, then hopefully we can give you some answers to try to help that out. Also with me, besides my wife Sue, who also is a member of Mount Zion, also is Matt Davis, my son-in-law. He does Medicare enrollment. That's his business, and believe it or not, it's free of charge. So a lot of things you can't do free of charge these days, but that's one of the things he does. He helps set people up for different plans of Medicare, so he could help us talk about different plans of Medicare and what to expect. And then, of course, my lovely daughter Maggie, she's with us too. I guess we want to start out by just asking how many people here have Medicare. How many people love Medicare? I do. And so this is going to be, and how many people don't have Medicare? All right, so oh, well, we're going to talk to a little bit about different things. There are so many different aspects of Medicare. Of course, you get it when you're 65. In my case, I got it at 64 months and 64 years and 11 months due to Matt. He told me I could get it a month early, so I don't know how that worked. I think my birthday was on the first of the month, so therefore I got it. I did not realize that, and it was one of the things that he can talk about. There are different plans of Medicare. They do cover quite a many of things, and that's what we want to talk about today. What else do you want to say?
I think the biggest thing now is, and probably when a lot of you got your Medicare plans, it was just the original red, white, and blue Medicare. Now, a lot of the commercial payers like Anthem, Aetna, United Health, Cigna also have Medicare plans, which Matt can attest to and talk about. But they're called Medicare Advantage plans. So they're a little bit different than your original red, white, and blue Medicare. How many had a horrible experience when you signed up for Medicare?
And how many people really understood what they were getting when they got Medicare? And that's a big thing. Is you kind of go to Java or they start sending you stuff in the mail, and you just kind of try to read and sign up. And so there's a lot going into it, Medicare and the plans that Matt can help us with. When you do get Medicare, they do offer a lot of free things that we should all take advantage of. One of which is a Welcome to Medicare physical. And when we say welcome to Medicare physical, people think it's a whole entitled physical exam. And so, but it's a misnomer in that it's actually a wellness check. So what we do in a Medicare wellness exam is basically gather all your information that you have with your medical and go over everything that you had or are having problems with. We try to also go over your medicines and make sure that you are taking the right medicine or you know exactly what you're taking and why you take it. We also talk about family history. So we do everything other than listen to your heart and lungs. So, but we gather all the information to put it in a chart so it's clear so that you understand what's going on with you and what you're taking and why you're taking the medicine. And so, and then the physical comes later. So really a welcome, when they tell you that you're gonna get a welcome to Medicare physical, that's basically an update of your medical history. Basically, that's what it is. And screening. It talks about whether you can hear or not. We talk about depression screening. We talk about your cognitive skills and see if unfortunately, everybody's worried about dementia or memory loss. We do little tests there, and we kind of screen. So those things are just screening tests. And then after you do that, then you can get what we call an annual wellness exam every year. And a wellness exam is the same thing as the initial one. They go over everything every year and just make sure everything is going fine, different than your physical. And those are the things that you don't have to pay for. You never have to pay for a wellness exam or an annual exam. But you do have to, unfortunately, most of my patients, we have other problems other than, they have high blood pressure, got diabetes. So at the same time that we do a wellness checkup, I guess I should say, we do an exam. And unfortunately, Medicare doesn't pay for the exam at the same time that they do the wellness checkup. So sometimes people do get a separate charge, and people get a little upset because they're saying the wellness exam is supposed to be supposed to be free. But a wellness exam is only basically gathering information, trying to make sure you are doing all your medical problems, you understand them, your family history, if anything changed. A physical exam is totally different. What else is there?
I think Matt now can talk
Yep.
about when to sign up, when they're eligible to sign up.
Mm-hmm.
Good talking, just talking.
Yeah.
And to continue with that, if you do have some sort of insurance plan along with your Medicare, then some of these services that he's talking about would be covered. What he was referring to is what Medicare will always cover, even if you don't have insurance. If you do have extra insurance and you have to go to the doctor because of the high blood pressure, whatever it may be, depending on the insurance, it may or may not be covered. Just depends on what plan you have, because there are a lot of different options. So what did you want?
So there's any questions about any kind of plans per se, or the question is also, should they review their plans every year? Or should you just stay with what you got, or what would you?
It depends. It's certainly worth looking at. He mentioned Java earlier, so Java is a great resource. I do recommend that anybody that's new to Medicare, especially, talk to Java first. After they do that, they can certainly call me, and I'd be happy to help them. But Java is a non-biased place where you can get information to compare your plans, and they're not going to charge you anything. And they're not.
I think we should review our plans every year. I just experienced myself where I didn't review my plan and I missed the first 22. And I lost coverages with the coverages I had. I don't know how to tie in.
Sure.
Nevertheless, I lost coverages, but I didn't realize it was I needed. But thank God for looking at significant.
Right.
That I lost anything, but I didn't lose coverage, so I had to reinstate my plan that I had with the man of the circuit coverage, and all the technology
Sure,
Certainly
I understand.
want to review your plan beginning October to December.
Correct.
Or you can lose coverage at the end of the year, January 1.
Right. Yeah, there's an annual enrollment period at the end of each year, October 15th through December 7th. And that's the time where you can compare your plan and make changes to your plan for the upcoming year. That period of time is specific for Medicare Advantage plans and prescription drug plans. So there's also a different alternative type of medical coverage called a Medicare supplement plan. Those plans do not are not affected by that enrollment period in any way. Those are something you can compare and change really any time of the year. And yes, ma'am. You can change this Medicare supplement any time of the year,
Oh, sorry. The supplemental insurance you can change
but-
anytime during the year.
but there are health questions involved in changing from a supplement to a supplement.
Okay,
So if you have a Medicare supplement and you wanted to move to a different one, or if you didn't have a Medicare supplement, you wanted to join a Medicare supplement, you would have to answer health questions in order to make that change, but you can go through that process any time of the year.
is that a cost doing that when you switch over?
There's
I
no,
know what,
there's no cost. You mean to switch from a
Switch.
supplement to a supplement?
Yeah.
Say to bring your premium down?
yes.
There's no cost to doing that. No, ma'am.
Okay, thank you.
But it is also, don't you have to, you encourage to, if you're like new to Medicare, you get your supplement right away in the initial period.
Correct.
As opposed to
Cor-
waiting and getting your Medicare and then later.
Yep.
Getting the,
I'll elaborate on that in just a moment. Yes, ma'am.
All the way up.
So I have a question in regards to choosing a plan, a Medicare Advantage plan.
Okay.
Is there anything that we need to be looking at in terms of choosing a plan, like aligning your physicians and your medications with the
Absolutely.
plan that you're choosing?
Absolutely. Yep. So I think the main thing to look at is the two types of medical plans. Really, there's Medicare supplement, there's Medicare Advantage plan. Within each of those, there are going to be numerous options that cover different things that cost different amounts of money. And so a traditional Medicare supplement is a plan that works alongside original Medicare A and B. So you have Medicare paying first, and you have that supplemental plan there to fill in the gaps of your hospital and doctor services. The alternative is a Medicare Advantage plan, which is a plan which you see advertised on TV all the time. And that is when an insurance company such as Humana or Aetna or United Healthcare, whoever it may be, they essentially are taking over your Medicare and becoming your primary. And they function just complete. Yes, sir.
I want to put enough emphasis on reviewing the plan at the end of the year, because it did work out for me to my advantage, where I used to pay $38 a month on a certain section.
Mm-hmm.
I don't have to pay that now. I get that coverage
At no
free,
cost. Correct.
Okay, not only I get that coverage free, but I get additional. So the plan that I have now
Is a better plan
is
all
a
around.
much better plan,
Yep.
and so it is worth reviewing
Yep.
at the end of the year to your benefit.
Yep.
I'd like to say something. Most people, even myself, don't know the difference in a HMO and a PPO.
Sure.
And that's something that needs to be explained, because I got a new one for this year, and it was a HMO. And believe me, I won't get an HMO next year.
Okay. Yeah.
You know, and so-
So the Medicare supplement plans, going back to that, those plans are never HMO plans or PPO plans. Those plans also do not change the benefits from year to year. The benefits will always stay the same. The price will fluctuate over time, but the benefits do not change. The Medicare Advantage plans, which are typically lower premium plans, but they have copays, those are going to be either a PPO or an HMO. And so those do have a network of doctors. Those are what are marketed heavily. And in those plans, the PPO plan, technically it depends on the specific plan, but usually a PPO plan, if you go in the network, you pay one copay. If you go out of the network, you pay a higher copay. Or with an HMO plan, typically, if you go in the network, you pay the copay. If you go out of the network, they don't cover it at all, which is becoming less and less of an issue. It used to be a big issue where very few doctors were in the network with the plans, but at least in this area, it seems that usually doctors will be in the network for either the PPO plan or the HMO plan. But those Medicare Advantage plans always will change the benefits to some degree, either improve them or reduce the benefits on the first of the year, which is when you should be comparing that plan and the changes during the enrollment period in the fall. And that's when you can look to see if they're still going to, if you have an Advantage plan, if they're still going to include your doctor, if they're going to cover your medications, if the copays are still reasonable, if it still makes sense. Yes, ma'am.
Sir, while you're talking about the HMO, HMO and the PPO, can you explain, because I don't think everybody understands the difference in those two pieces.
Okay. So again, that's PPO and HMO are two different types, two different ways that a network plan would function, and how the plan treats a network and who you're seeing. They both have a list of doctors, and typically with the PPO, you pay a lower copay if they're on the list. You pay a higher copay if they're not. With the HMO plan, you're only covered if they're on the list. Does that make sense? All right. Okay, sure. And I'm happy to answer. Yeah.
And some doctors don't take certain insurance plans. So
Right.
if you do switch, or like that you need, and you're used to your certain doctor, sometimes they don't take that one. So you would have to go to another physician, or as we say, pay out of pocket, so to speak, if you want to stay with your physician.
Did you have a question?
So I'm getting ready to turn 65.
Okay.
But I'm still working.
Okay.
So is it best for me to keep the insurance I have now,
Mm-hmm.
or do I go to Medicare?
It depends on what they're providing to you. Does it cost you anything? So it depends on how much it costs. It depends on what it covers. So because you have the option to go on to Medicare and get your own private plan and drop the employer coverage, or you can delay signing up for Medicare and keep the employer coverage. It's just a matter of the benefits and premium differences. So it's not always a clear-cut answer. It depends on, I would need more specifics to really give you advice on that. So be happy to look at it. If you can always check with me later.
But my next question would be, so can I keep act with my job and go Medicare?
Keep Aflac, is that who your health insurance is with through your job?
My disability.
That's a question for HR. You'd have to ask them if you can keep one but drop another. Like if you didn't want the health plan but you wanted the Aflac coverage, sometimes a company will allow you to do it. Sometimes they say you have to keep it all or not at all. And I think you wanted me to elaborate more, and it's kind of related to that. When you're first turning 65 and joining Medicare for the first time, if you're drawing Social Security already, you're typically going to be automatically enrolled into Medicare A and B. If you're not drawing Social Security, then you actually have to contact them to say, for the month that I turn 65, I want to be on the Medicare A, Part A and Part B. And that would be really the first step, is getting Medicare set up. And then from there, prior to your birthday month, you would want to talk with somebody to evaluate your options, to to look at the different types of Medicare Advantage plans, Medicare supplement plans to see what's going to be the best fit for you. And the supplemental plans, which are more expensive, and they do have the health questions, you can skip those health questions when you're first starting on the Medicare, whether it be when you turn 65 or if you delay Medicare because you have coverage through your employer. It's whenever you sign up for Medicare in the future. You can skip the health questions on a supplement one time.
Can I ask you a question? Now, it used to be a time, I don't know about now, because I've been on it for a while. Part D, if you didn't sign up early, they would penalize you.
That's correct.
Later. I think, whoever, most
Yep.
of us got some kind of medicine.
Yep.
Need to be told.
Yes.
Yes. So what she was asking about is with the prescription drug side of things, the Part D of Medicare, that there's a penalty that Social Security will charge if you're on Medicare, you decide you don't want a drug plan, or if you didn't sign up for one somehow or another, but then down the road you go to join a prescription drug plan, Social Security will penalize you for that time missed. So that's an important thing as well, is that you don't miss out on joining the plan when you're first starting on Medicare. And some of the medical plans will incorporate prescription benefits in them. The Advantage plans a lot of times do that. If you go with the Medicare supplement route, although it is better coverage at a higher premium, you would have to buy the drug plan separately.
We were told that in the enrollment period, we should not change supplements, because if we did, all the ailments or whatever we had, the new people probably would not take them. So that's why you don't supposed to change supplements.
So the enrollment period doesn't have there's no connection between the enrollment period and Medicare supplements. As I was saying earlier, you can change your supplement any time of the year. There will always be health questions involved. And so I'm not sure why, I'm not sure what they were referring to when they
Where we had the supplement, one of them is State Farm.
Okay.
So they were saying if they changed, I forgot something my husband was taking. They were saying that he couldn't, depending on where he got the new plan, he may have to pay out of pocket rather than what we were getting from them.
Yeah, I'm not sure. So say, and again, it has no connection to the enrollment period. Any time of the year, if you have a supplement and you want to change to say your supplement's gone up and you want to change to a different supplement that'll give you the same coverage at a lower price. The way that I would take care of that is would go through the health questions on the new plan with the person, send it to the new company, let them review it, and they decide if they're going to accept that person or not. And if they accept it, great, then we notify the old company and we cancel it. If they do not accept it, you just carry on with what you have. But if they do accept it, they're not going to put a stipulation in there that they're not going to cover those services. They would have to cover you immediately. They would have to cover you from day one. On a supplement, there's no sort of, it's Medicare calls the shots with a Medicare supplement. Medicare is primary. They have to do whatever Medicare says.
But are you also talking about medications from one supplement to another? One supplement will pay for this medicine.
Yeah,
And then it's like insurance companies. We have formularies that they go by. If somebody switches to a new formulary or a new insurance company, then the medicine they were on may not be covered by, and they might be preferred on their new plan. So therefore, they may have to pay differently. That happens when
Sure.
you go from the different plans. So it's an idea of making sure when you switch plans that you look at your medicines or have somebody look at your medicines and see if they're comparable to change over. Or you may be caught with, well, they paid for it before, but they're not paying for it now. You might have saved a little money, but in the interim, it may charge you more because you can't get on that medicine. or we have to switch medicines to something else. And that happens with commercial insurance too. I can't tell you how many times somebody's on Anthem and they go to Aetna. We have them on certain medicines for a while, and then they get to this new plan, and then this plan, their formulary, the medicine formulary is not the same as it is. So we have to either switch medicines, or most of the time we have to switch medicine, or the person will, if they want to stay on that medicine, they have to pay more for that medicine. So
Can you share with us what age 65, what would be the best plan for multiple, you know, go all the way to A through Z?
I can't hear.
What is the best plan that you would?
I don't know.
Age 65. Supplemental plans. There are multiples. You can go from A through Z. For me or anyone age 65, what is your choice here, or what can you share with me about the best option or best plan to pick out of that group?
So out of the Medicare supplement plans, there are multiple standardized plans that they're referred to as letters: plans A, plan B, plan C, plan D, and so forth. The best coverage of any is a plan G. Plan G is the best of any of the plans available. Supplemental plans, say plan G, for example, you hardly will ever see any sort of advertisement for a supplemental plan. Truth be told, those plans cost more money for the beneficiary. They cover more, but truth be told, there's less money in it for the insurance companies, which is why they put all the money into the commercials to push the Advantage plans instead. So I think it definitely is a good thing to talk to somebody to review all of your options, but I always advise to be careful about the phone calls and TV commercials, because they are saying whatever they can to get you to switch to their plan, and you might not ever hear from them again. And I don't think that they're going to spend the time to confirm all of your providers and medications and all of that are covered as they should be.
What are the things that when you choosing a plan, you said plan G is the best plan. What were the things I will be looking for if I'm the new person just to get ready to start Medicare next year? What should I be looking for in a plan?
Depends on your situation.
Okay.
I mean, there's not a single best plan for everybody. To answering your question, that is by far the best benefit plan. It has the best protection when you go to the hospital or to the doctor. If you have a plan G, you're going to be covered better than any other plan available. And is that the best for you? I'm not sure. It really depends on your health history, your financial history, your risk tolerance, all of that.
on an average, what would a G plan cost? Could you say what a G plan would cost somebody extra?
When you're first starting Medicare at 65, in the ballpark of 100 to 110 a month for a plan that would work with Medicare. And if you went to the hospital, you would not pay anything. If you went to for outpatient medical, you have a deductible of $226 per year, and then it's covered in full.
And that's on top of the supplement. I mean, that's on top of the Medicare.
That is on top of Medicare's
So,
premium, right?
As opposed to one of the other plans.
Which is why the Advantage plans are more popular, is because the Advantage plans a lot of times are zero premium. So everybody's going to have to pay the premium for Medicare itself. So then if you go with the supplement, you're looking at $100 or so on top of that. If you go with the Advantage plan, you're looking at zero on top of that. But you do have then either a PPR or an HMO plan. So you have a network to stick to. And then even when you're going in the network, you still have copays to pay, versus with the more expensive plan, a lot of those copays are eliminated. Yes, sir. This, yep.
Okay, just a question, just to be clear. So Medicare fee for service, right? Red, white, and blue.
Yes,
Right,
original Medicare. Right.
Original Medicare.
Yep.
That insurance requires a supplement plan. A supplement
Doesn't
It
require.
but
Doesn't require.
You can choose to, because Medicare only pays like 80%,
Yeah.
about 80%
Right.
of the services that you may get.
Correct.
Okay. In addition to that, so it would be to your advantage to get, if you could afford it, to get a supplemental insurance.
Correct.
But in addition to that supplemental insurance,
You
you
need-
also have to get a prescription plan
Correct.
as well.
Correct.
Right? And so therefore and then your Part B you pay for, and it comes out of your
Social Security.
check.
Right.
So that's the stack, right?
Yep. Yep. You've
And
got.
that's why the Medicare Advantage plans are so popular.
Correct.
Because of the cost.
Right.
Right?
Correct.
Yeah.
Correct. Because there's zero premium to the Advantage
Yeah.
plans, but they also, a lot of them do include some additional benefits, not everything that's promised on TV. And so it's very attractive because of those things. And if a supplement is unaffordable, which you're right, you have to pay the premium for Medicare, you have to pay the premium for the supplement, and then the premium for the drug plan, it can add up. It can get up to $250, $300 a month for very good coverage, but it's, it can be quite expensive.
Yeah.
Now, I know we've heard of things on TV. We're talking about TV that I've seen commercials come out that say that, well, you can get X money back.
Mhm.
You get free this, free that. It's in there somewhere, but it's not practical.
Yeah.
Yeah.
I mean, there are the Advantage plans, which is what the commercials are for, are very specific to where you live. That's why they mention the zip code, but it's county specific. So they will cherry pick the best of the best benefits from the plans all across the country, and then mention it and say, you may get this, you may get this, you may get this. There's not a plan out there that's going to do all of those things. And a lot of the money back that they're promising would only apply in a situation if somebody had Medicare and Medicaid. But they want to get your attention first, and then they say, well, we can't do that, but this is what we can do.
Plan G, does that cover dental, vision, hearing?
No.
Everything?
Medicare does not cover most vision. They cover some vision, but if you're diabetic, they would. If you have glaucoma, macular degeneration, or cataracts, Medicare would cover those. But for routine vision or dental services, Medicare does not. Therefore, that Plan G supplement wouldn't either. So that would be another thing. If that was important to you, you could always add that, right? And then it gets definitely close to $300 a month. And another reason the Advantage plans are more and more popular, because a lot of those will build in dental, vision, or hearing benefits.
Can you share with us about Medicare Part A and B? If you have only Medicare Part A, what part of that hospitalization is covered by Medicare?
So if you only had Part A, I would, if you're 65 and you do not have employer coverage, I would always recommend getting both A and B. So the only scenario where somebody would just have A is if they were still working and covered through their employer, because the Part A side is as long as you work 10 years of your life, the Part A side is no cost to you. So even if you still have coverage through your employer and you were going to keep that, you would still sign up for Part A because it's free. Part B is the one that has that $164 premium, which you would delay if you were going to keep the employer coverage. But Part A would cover hospitalization. Part B would cover outpatient medical, like doctor visits and surgeries and things like that.
And you have to pay that every year. You have to pay that $164.
You pay it every month.
Right.
Everybody pays it every month.
Right.
Comes out of the Social Security check.
That's right. Excuse
Yeah,
me.
yeah.
I was thinking about the deductible that they have every year.
Right.
That they have to pay a deductible on top of that every year. And you have to meet your deductible before Medicare can pay this other stuff. So
I have one more question. That's
Okay.
a lot of us who have Medicare, when we are traveling
Mhm.
and we travel outside of the US, does Medicare cover us?
They do not. Nope, they do not. But it depends on what plan you have. If you have something along with Medicare, whether it be a supplement or Advantage, some of them will, some of them will not give you foreign travel coverage. But Medicare, by default, if you just had Medicare, they would not. Yeah.
Yes, ma'am.
I have Cigna through the federal government, and I have Medicare A and B.
Mhm.
I don't pay any copay. Is there anything else I need to be concerned about? Any
Prob-
changes?
Probably not.
Okay.
I mean, I'd have to look at the specific plan, but I would, my guess is that you're probably just fine where you are. Yeah. Yeah. And one other thing is, depending on what you have, if you are enrolled into a plan, whether or not it was accidentally or not, this is something that happens quite frequently with people who are getting unsolicited phone calls. They will be marketing Advantage plans. They don't cost any premium to it. And they will enroll somebody into the plan. And that could have negative impacts on what you currently have or what you want. You know, if you wanted to keep what you currently have, them enrolling you into a plan can affect that coverage. And actually, if you had a supplement and were enrolled into an Advantage plan and didn't even know you were on it, the supplement is obsolete at that point. And I've seen where people will have a supplement for over 12 months and have an Advantage plan, and the supplement would never have paid a single claim for them that whole time. But they didn't know that because somebody enrolled them and didn't take care of making sure that their plans were aligned or that they canceled out the old plan.
We have an online question, and so the person says, correct me if I'm wrong, I can change my prescription plan anytime during the year?
That is incorrect. You can only change the prescription plan at the end of the year, which is when you can also, if you wanted to change the Advantage plans, and that's the time, that's really the only time that you can. It's October 15th through December 7th. Yeah.
So if a person has an Advantage plan, they don't need a supplement plan,
You would never want to have both at the same time. So
but you would need a prescription plan.
if you have an Advantage plan, there's a good chance that it has built-in prescription coverage. Not all of them do, but most of them do. But since the supplemental plan is there to work alongside Medicare, and the Advantage plan essentially is working in place of Medicare, if you have an Advantage plan and a supplement, they're not going to work together. So you would never want to have both. Yeah.
Is it true that with Medicare Advantage plans, there is a cap or a limit on the amount that you, the patient, has to pay first if you are hospitalized, and then your Medicare Advantage kicks in? Is that true? Or does Medicare Advantage pay your hospitalization?
So it depends. Every Medicare Advantage plan will have what they call a max out of pocket, which is the maximum exposure that you would experience in copay. So you pay a copay for a doctor visit, copay for hospital, and you're in and out of the hospital and you're paying copays. If those tally up to whatever that yearly max is, from that point on, you don't have any copays for the rest of the year.
Okay.
And it's usually, it can fluctuate by plan, but it can be, $5,000, $6,000, $7,000, which I haven't seen many people hit in a year. You have to be in and out quite a bit. But they all are required to have some sort of out-of-pocket max. The Medicare supplements don't have that because, say, for example, the Plan G supplement, the only thing you're paying is the $226 deductible, and that's it. So they don't have that max out of pocket because there's no need for it. Yep.
Is the regular Medicare, is that better than the Medicare Advantage? If you have the regular Medicare and then you buy your dental and your eye insurance, or just get the Medicare Advantage with all of that included?
Again, it depends on everybody's situation's different. I probably would not recommend just having original Medicare A and B and nothing else. I mean, you mentioned dental and vision, but just having original Medicare A and B with no other medical coverage to supplement that. So yeah, it depends on the situation. But if you had original Medicare and had a supplement, not Advantage, but had a supplement, you would have the better coverage, but it would cost you more per month.
I had a supplement one time, and I do know if anything that Medicaid don't pay for, your
Mhm.
supplement won't pay for.
Correct. Yeah, Medicare calls the shots, which
That's right.
which
So
I think. I'm sorry. Go ahead.
even if you got it, and I mean, it don't make a difference if Medicaid don't pay for it. Your supplement ain't gonna pay for it neither.
Correct. Which I think is actually a benefit there. Of course, it's a problem if Medicare denies something, but most services medically that you need, Medicare will cover. If you have an Advantage plan, they're the ones calling the shots. So you have an insurance company calling the shots versus Medicare. And that becomes a problem a lot of times when somebody needs to have something authorized, such as extended stay at a skilled nursing facility. Medicare just by default will cover that, where if you have a Medicare Advantage plan, it has to go to the company and they will approve it or deny it. And I've seen cases where it's been denied and somebody's basically being kicked out of the skilled nursing facility and they're not ready to go home.
So a lot of supplements don't. I had one, and it started off good,
Mm-hmm.
and the price kept going up.
It sure does. Yeah.
And it got to the point that I was paying $100. Almost the raise at the end, it was $173, and I finally canceled it.
Sure.
Because it didn't pay anything.
Yep.
All I was doing was giving them my money. So
Yep.
you really need somebody to help you. When it first started, like I say, it did good, but it ended up as the years went along,
Yep.
it was just giving them the money. They wasn't doing anything in the process.
Would you address Medicare A again, please?
Which part of it are like so Medicare A cost-wise premium
Going into the hospital.
going into the hospital. So Medicare Part A is for inpatient care, hospitalization, and for skilled nursing. That's really about all that Part A does. Most any other medical would be considered outpatient and would go under Part B.
Also, would you address, let's see, if you're in there, I'll just say it. If you have your hips and your
Yep.
knees done,
Okay.
and you're in there less than 24 hours, Medicare will not pay.
So I've heard of them trying to keep you from being admitted, and then they call it like observation,
Yeah, that's
right?
what-
And in that case, it would go under Part B of Medicare as outpatient, as opposed to Part A of Medicare. So it would still be covered by Medicare. It's just the way that they cover it, whether or not it's an Part A service or Part B service, it can vary, and depending on the coverage that you have. If you have a supplement or an Advantage plan or what you have, that can also fluctuate and fall back on you depending on what you have. Yeah.
Right, I think you have to be, when you go to the hospital, you have to ask them, am I being admitted or am I being observed? Observed, they don't pay. And that's what you were talking about. And that's not in the, right, that's not in the Medicare plan. So a lot of times they say, well, we'll keep you overnight to observe you. You know, you're not sick enough to go in the hospital. We're just going to observe you and see if you get better. Well, and even though you stay in the hospital, if they classify it as observing, then Medicare won't pay for that. I mean, basically, they'll kick it over to something else, and you'll have to pay part of that, all of that. So I usually tell people, you're not observing me, you're hospital, you put me in for 24 hours, so that's what, so that's one thing you always want to think about. Other thing we were talking about is Medicare is a lot of good happens with Medicare. What we don't do a lot of is immunizations. They do pay for pretty much all immunizations now. And I would encourage you, if you haven't gotten immunizations, you need to do that. And we're talking about shingles. We're talking about Tdaps or tetanus. We're talking about pneumonia vaccines. We're talking about pretty much all vaccines Medicare now pays for. They used to not pay for shingles. They recommend you getting shingles, but they wouldn't pay for it. And if some people would know, it's like $165 a shot. That's what they would. So a lot of people wouldn't get shingles, single vaccines. But now, as of January 1st or something like that, Medicare now does pay for it. So I advise everybody to get those immunizations. I know you don't want to be shot. You can, but it's very important that you get these immunizations. Some things they also will pay for is, what else will they pay for? Yeah, of course, all the regular health stuff, the mammograms, the colonoscopies. Now some people have had colonoscopies. Some people, believe it or not, at age 65 have never had a colonoscopy. And I fight with people every day. They do pay for other tests that goes along with colonoscopy. You might have seen the Cologuard that's on TV. That's a DNA test. They test for abnormal cells. Medicare pays for that now. But that's only good for 3 years. You get one done. If it's negative, it's pretty much 95 and 97% effective that you don't have colon cancer. But it's only lasts for 3 years, so you have to do it every 3 years. The gold standard is actually to do a colonoscopy. That's the best. But if you somehow don't want to do that, you could do that, and Medicare would pay for it. Yes.
In reference to immunizations, I was recently told that tetanus shots will not be covered in a physician's office, but the pharmacy will cover it. Is that true for all immunizations?
Pretty much now. Yep, they took it out of our hands to.
Since the pharmacies are now doing them, they want people to use the pharmacies.
Yes, so a lot of doctors' offices like ours won't give you immunizations. Unfortunately.
For tetanus, if you come in for a wound, an open skin area, we can give you a tetanus and they will cover it. But that's the only way they'll cover it.
Okay, because I didn't get it that way.
I'm sorry.
How did we get that way?
I didn't hear it that way. I heard that even if you had an open wound and you came into your physician's office, just for the tetanus shot?
They'll pay. That's the only time they will pay for something like a tetanus. Yeah,
Only time.
but they
Okay.
won't pay for it. Say you come in for a routine. We notice that you, like I was saying, the wellness exam, we noticed that you haven't had certain immunization. We could give it to you, but Medicare wouldn't pay for it. Then you get a bill for the charge, and then we get fussed at because we gave you a bill that you shouldn't have got. So, yes, ma'am.
When I got one at Walmart, I paid $70 for it.
They've been paying for it. I don't know how come.
Was it after the first of this year?
I don't think so. Was it
Yeah.
you say it just started
Yeah,
this
it
year?
just started January 1st when they started paying. Yes, ma'am.
If a person has a Medicare Advantage, could they switch back to regular Medicare?
So you can only drop your Advantage plan. At the same time, you can join the Advantage plan at the end of each year during that enrollment period window. So you can drop the Advantage and go back to original Medicare at that time if you wanted to. And what I was saying earlier is I probably wouldn't recommend going to just original Medicare. If you were leaving an Advantage plan and wanted to go to original Medicare with a supplement, that would be the only time not that that's the only time you can join the supplement, that's the only time you can leave the Advantage plan. But if you do that, I would make sure that the supplement has reviewed and approved your application before you leave the Advantage plan, because you don't want to end up in a situation where you don't have either.
Is there a time frame for that review of that? So you're going to switch from Advantage to regular or standard Medicare. Is there a time frame that your supplemental should be reviewed before you switch?
So there's no time frame as far when you're moving to a supplement. There's no time frame as far as when you're allowed to make that change. You can do it whenever. The time frame would be related to leaving the Advantage plan. You can only leave it during the enrollment period.
Right.
But I think what you're asking is roughly how long does it take? If you're applying for a supplement, they have to ask the health questions and review it and get back to you. How long is that process?
That's correct.
It's usually a week or so. Yeah.
Are supplement plans controlled by city, state, and county?
No.
Okay.
No. I mean, the only thing with the supplemental plans, there are a set of plans identified with letters like Plan G. The benefits are standardized. So a Plan G supplement with Anthem is the same as a Plan G supplement with Aetna, for example, and they have to cover the same, but the pricing fluctuates because they can charge whatever they want to, but you're getting the same benefits with either of those companies. And a key thing with that is that sometimes companies will start out with a low premium, but they're going to jump up faster than the others. So the lowest is not always the best if they don't have a track record of keeping their rates stable. Yep, right here.
Ms. Bill.
This is just a point of information. I retired probably about 9 years ago, and I didn't have a clue about supplemental or Medicare or anything. All I knew is that my company was associated with a group and my insurance would not follow me. So it wasn't that I could pay a premium and continue with the same insurance. They offered me, I think it was Cobra.
Which is
I didn't know about Cobra at the time. And I had always heard that may not be a wise choice. So I was referred to go to Java.
Yep.
And Java sit down with me and went over each plan, each Medicare A and B, each insurance company according to what I might need.
Right.
So I would recommend to anyone, I don't know if they've changed, but Java, and I heard you allude to that.
Yeah, absolutely.
Java is a good place to go to sit down and get some explanation
Yeah.
about what you need.
Java's no charge. And
Can
again,
you-
they'll give you unbiased opinions. They're not making money
Right.
in the situation, so they're going to be honest with you.
Correct.
A lot of the people that come to me when they're turning 65 or starting on Medicare, they've gone to Java, and now they're coming to me. Java can take care of some things as far as actually they can certainly educate you, but they cannot necessarily enroll in all plans. They can enroll in some. So a lot of times people will then come to me and can kind of go over what they went over as well, and then I can actually finalize getting them set up.
Could you also talk a
For
little
no
bit
charge.
about
No charge.
can you also talk a little bit about Cobra?
Sure.
Because people don't know what Cobra is. It's quite expensive.
It can be. Yeah, Cobra, if you work somewhere and you're covered and then you're retiring or you're leaving the employer, they're required to offer you the same coverage for 18 months, but they're not going to pay their portion anymore. So you're going to pay what you were paying for it plus everything they were picking up, which usually is a substantial amount. So it can be $700, $800, $900 a month. You get to keep your plan, but it depends on your situation. In a lot of situations, it is not the best thing to do. It's usually better better to get private coverage. Yep. Berkmar. Yeah, right next to his on Berkmar. But yeah, I can give you a card or something. Yeah, that's best.
For those that don't know, when you retire from UVA,
Yep.
for those that don't know, when you
Yep.
retire from UVA, UVA also offers you a Advantage program of their own to be able to stay with, and that's usually high. So you normally have to look at vows, compare vows, and go and talk to someone, as you say,
Yep.
about everything else because it can be very expensive.
It is. Yeah.
And I retired in 2020. And I had to do the same thing. And I just so happened I knew an insurance agent that would help me through
Good.
that I could depend on.
Yep. I'm very familiar with that plan. They call it the Advantage 65, but it is actually a Medicare supplement. It's not a Medicare Advantage plan. It can be just to confuse people, but it is expensive, and you can get comparable coverage on the private side for less money in most cases. Yep.
So, can you explain a little bit, what exactly is Medicare Part C?
Medicare Part C is Medicare Advantage plan. It's the same thing.
Is it the same Medicare Advantage plans though that like other companies offer, like Aetna, for
Yes.
instance, or
Yep.
Anthem or whatever? The same plan.
It's the same. Yeah, it's the same exact thing. It's just it's usually I refer to it as Medicare Advantage. A lot of times I know like advertisements and commercials and stuff, they'll call it Part C of Medicare. And I think it is Part C of Medicare, but I think they use that term to make it sound like something the government is offering to them, when really it's something that's an insurance company is offering. It's not coming from the federal government.
And Medicare Part C is different than Parts A and B?
That is correct. Yep. Yeah, that's Part A and B is what you think when you think of Medicare, the red, white, and blue card coming from the federal government. That is A and B, your hospital and the doctor. And D is prescription
Right.
drug.
D is drugs, drug coverage.
For those of us who have the Advantage plan
Yep.
at 65, what is your recommendation for us if we want to look or go back to the standard Medicare? And what would be the advantage?
The advantage, so we'd have to, again, a lot of this stuff, it really is dependent on the individual, their situation. So it's hard to answer a lot of these questions without sitting down one-on-one with somebody. But the advantage to that, why would they want to switch from a Medicare Advantage to a supplement is it would cover their medical services better. But again, you have to weigh the premium differences between them to see if it makes sense. And so a lot of times when somebody is on an Advantage and I talk to them and they want a supplement, it's because they've started paying out a lot of copays because they develop an illness. But now you've got to answer the health questions to get the supplement. So you may not be able to qualify. You may be stuck with that Advantage plan. Does that answer your question? Or is there another part to that?
I'm leaning towards folks who are in the Advantage, who have the Advantage plan, whether or not it's beneficial for them to go back to the straight Medicare. That's where I'm headed. I'm just asking.
Yeah, I wouldn't recommend, again, I mentioned earlier, I wouldn't recommend dropping the Advantage plan. And that if you just drop the Advantage plan and do nothing else, you would go to original Medicare A and B. And I wouldn't recommend necessarily doing that unless you had applied and been approved for a supplement to A and B. And in that, it might make sense to do that, to have the better coverage if it makes sense cost-wise, premium-wise.
Say, even if you do that, you still is expensive because if you drop your advance and went back to regular Medicaid, then you got to turn around and pay extra for
the
Part
supplement.
D,
Correct.
as well as a supplement if that's what you want.
Correct.
So if you're gonna pay all that money for them to, you might as well take that money and pay a few co-pays.
Mm-hmm.
It'd be a whole lot cheaper.
Yep. Sir. Yep. Yep.
Right.
Yes.
Yep.
Right. You have to
It's-
get your own
yeah.
dental and things planned. Yep.
It's a gamble, really, either way. There's no way to know the right answer. Sometimes you don't really have the choice if you're in a situation where even if you wanted to pay the high premium, you may not be able to qualify. But I've seen or talked to people before that are on an Advantage plan and they're in and out the hospital. They have ongoing medical conditions, chemotherapy or dialysis, for example, and they end up hitting the yearly max that you asked about earlier. Say, their max was $7,000. So they're not paying the premium, but they're hitting the $7,000 max every year. So it would have been cost effective if they had a supplement in that situation. And that's just one extreme example, but it just depends.
But just like anything else, I think you owe it to yourself to at least review stuff every year. Because health changes, medicines change, your conditions change. So just like anything else, I think it behooves you sometime to at least just don't go with the flow all the time. Maybe just get it checked up every couple of years, every year supposedly, or every couple of years, just to see if there's anything better and different. So.
Yeah.
We were talking about plans.
There's your mic.
I'm sorry. What's the difference in a plan F supplement and plan G? Is there a lot of difference?
So you asked earlier what the best supplemental plan was, and I said Plan G. That's the best supplement you can get now. Plan F is something they've stopped writing to people if you turn 65 January 1st, 2020 or later, you cannot join the Plan F supplement, something they used to sell. The two plans are very similar though. The only difference is with the Plan G supplement, you have to meet that $226 deductible at the beginning of the year. Once that's met, your services are paid in full. With the Plan F supplement, that deductible is even covered. So you were paid in full from day one.
So my understanding that there is no more plan F.
So you can't, no, unless you turned 65 or were eligible for Medicare prior to January 1st, 2020. So if somebody's in most cases, Plan F does not make sense. Plan G is actually the better value, even though it's a slightly lesser benefit plan. The difference in premium offsets that. Oh, you can certainly keep it. And people, if somebody was 65 already at that point, they can even join a Plan F still. You could definitely keep it if you already had it. It's not going to be taken. But in most cases, I wouldn't recommend signing up for a Plan F today. It's gotten very expensive, and the Plan G is usually a better deal. In a lot of cases, if you can qualify for the new Plan G, then you probably would save money. Yeah. Yep.
I'm glad I bought you.
I don't know what to say. It's just there's a lot of variables.
Yeah, thank you for being here.
Yeah, thank you. Any other questions?
Any other questions?
Any other questions?
For those persons that join us online, if you have a question, please type it in the chat section at this time.
Said a moment ago about if you're in the hospital and they want to put you overnight, you should ask them. I'm sorry. Dr. Stokes mentioned something about if you're in the hospital and they want to keep you overnight, you should ask them if it's for observation or if they need admission. And so if they say observation, there isn't anything you can say. I need to be here. Okay. Okay. Thank you.
Pick up and push for medicine, push for medical care. Or if you see sometimes your loved one does not feel like you're getting what they need, don't just lay there and take it. You know, ask somebody. Go. I've had people. I've gone to administration so many times. I've talked to patients in the hospital. They didn't feel like they were getting what they were just going with what the doctor said. And a lot of times they don't hear exactly. Doctors come in, they look at you 5-10 minutes, and then they're out the door, and you don't know exactly what's going on. Sometimes you just have to speak up. You just don't. You need to know about your care, just like you need to know about Medicare, the supplements and everything. Knowledge is power. And so I would say, like I was saying with the observation, if that's a possibility that they can admit you and you feel like that, then say, I'd rather be admitted than observed. But do it in a very careful manner. You're not telling the doctor what to do, but do it in a kind of a nice way.
They don't like that?
No. So,
Are there any other questions from our audience tonight?
well, thank you for allowing us to be here. Hope we answered some questions. I'm glad I brought Matt. He made my life a whole lot easier. So thank you very much.
Again, let's give another big round of applause to Dr. Stokes and to Matt and Susan. Matt, we definitely want to get some of your cards and things like that so we can have here at church. I hope that you found this informative tonight as well. As we prepare to get ready to go home, I think the bad is the children class. Couple announcements. Let's keep in mind tomorrow. Let's keep the Ragland family in our prayers. We will have the homegoing service for Sister Ethel Ragland tomorrow at 11. Choir members are asked to be back in it, and everyone else knows where you're supposed to be. Pastor Edwards should be coming in shortly. He was on the train watching as we were doing tonight. And he says thank you, especially to Dr. and Mrs. Stokes and to Maddie for being here tonight. Let's continue to be excited about what next week. I'm not sure. I think next week is going to be insurance. Tuesday night, we have stress first aid. We'll be here on next Tuesday night. Mr. Juan Diego Wade will be doing that session. And then on Wednesday night, I believe we'll be doing insurance. We need to encourage some of our young people to understand insurance is not a bad word. Okay, amen. So let's keep that in mind as well. Again, if you have other questions about Social Security and particularly about Medicare, I encourage you to write them down. We can get them sent over to Dr. and Mrs. Stokes, and we can try to get them answered that way. Special to our nutrition ministry for blessing us tonight as well. Right now, it's next week. We'll double check on that. Well, since you got yes, something. I believe so. I think it's gonna. We'll have more information by Sunday. We'll be posting it up as well. Since we all want to walk around and move and talk, let's stand and be dismissed. Okay. Thank you for those who joined us online. Deaconess Lee Christian, would you dismiss us this evening?
Please bow your heads. Let us pray. Our Father and our God, thank you, Heavenly Father, for this time together. We thank you, Heavenly Father, for the speakers, Lord God, that have imparted knowledge that we may make, Holy Father, better informed choices. Lord God, bless all of our sick and shut in and bereaved families, Lord God. Be with us, Heavenly Father, as we leave this place. Dismiss us from this place, but never from your presence. See us safely to our homes. Let everything be as it were when we left. In Jesus' name I pray. Amen.
Oh, yeah. Yeah, you too now.